In this video clip, I will be discussing intrinsic back muscles. We find these muscles deep to the extrinsic back muscles, which I'll highlight here. Highlighted here are two extrinsic back muscles, trapezius, this upper one here, and this lower one down here on either side called latissimus dorsi. These are two commonly known muscles on the back. However, these muscles do not produce movement of our vertebral column. Instead, they produce movement of our upper limbs. They either move our scapula or move our glenohumeral joint. The muscles we're going to focus on today are located deep to trapezius and latissimus dorsi. Intrinsic back muscles are all innervated by posterior rami of spinal nerves. These muscles extend all the way from the pelvis up towards the skull, and they help to produce extension of the vertebral column and extension of the head. Here in this animation, we can see extension of the vertebral column. Highlighted are some of the intrinsic back muscles helping to produce this movement. In addition to extending the vertebral column, these muscles also help to extend the skull or the head. These muscles can be divided into three different layers. In the superficial layer, there is only one muscle, which is called splenius, and you can see it highlighted here. Deep to splenius, we have a group of muscles called the erector spinae. Highlighted here are all three erector spinae muscles. Deep to the erector spinae, we find another muscle group called the transversospinalis muscle group. We'll start by discussing splenius. Splenius is considered a composite muscle because it's composed of two parts. Here we can see the upper portion, which is called splenius capitis, and below it is the lower portion called splenius cervicus. This particular muscle we can see is originating in the midline on the spinous processes, and it starts on the spinous processes of C7 all the way down to T3, and a bit of it also attaches onto the nuchal ligament, which I'll highlight here. Whoops, that's the occipital bone. Here's the nuchal ligament in the cervical region. The capitis portion, if I turn this laterally, goes up towards the skull cap and attaches onto the mastoid process, which is on the temporal bone. If I remove splenius capitis, we can see that splenius cervicus is attaching more lateral to the midline. This particular part of the muscle attaches onto the transverse processes of C1 to C3. When contracted bilaterally, meaning that when we contract it on both sides, this particular muscle will help to produce extension of the head and neck. When contracted unilaterally, this particular muscle will help to produce lateral flexion and rotation to the same side. Here we can see the right splenius muscle contracting to produce rotation to the same side. So the chin is moving to the right side. Here we can also see splenius contracting unilaterally, producing lateral flexion to the same side. Lastly, when contracted bilaterally, although we only can see one side of splenius, it produces extension of the head and the neck. Deep to splenius, we find the erector spinae muscle group. There are three muscles that make up this muscle group, and I've highlighted them here on the left. They form a column of muscles from the pelvis all the way up towards the skull cap, and they span between the angles of the ribs all the way over to the spinous processes. The most lateral erector spinae muscle is called iliocostalis. It starts down on the ilium and goes up towards the costals or the ribs. The intermediate erector spinae muscle is called longissimus. You can see here it is quite a long muscle. And lastly, the most medial one is called spinalis. An acronym you can use to help remember these muscles is I like standing. The I stands for iliocostalis, the most lateral one. The intermediate one, so I like, the like stands for longissimus, and standing stands for spinalis. Although you might not like to stand, these muscles do help you stand up. So if you were completely flexed over or bent down tying up your shoes, in order to extend your back, you would need to use your erector spinae muscles. As you move from lateral to medial, these muscles get shorter. That means that the longest one would be iliocostalis, and the shortest one would be spinalis. Each of these muscles is divided regionally into three different parts, and these parts are named based on where they attach superiorly. I'll start with iliocostalis and describe its regions, and then work my way to spinalis. This part of iliocostalis is called iliocostalis lumborum. Lumborum referring to the fact that it's in the lumbar region. The next region of the muscle is called iliocostalis thoracus because it's within the thoracic region. And the superior aspect of this muscle is called iliocostalis cervicus. Longissimus also has three different regions. The portion which attaches directly onto the skull cap is called longissimus capitis. The portion of the muscle extending or attaching up into the cervical region is called longissimus cervicus. And the muscle fibers which attach up into the thoracic region is called longissimus thoracus. Lastly, for spinalis, which is the shortest of the three erector spinae muscles, it also has three parts. So here we have spinalis thoracus, extending up into the cervical region, we have spinalis cervicus. And then lastly, this muscle indirectly attaches to the skull cap via the nuchal ligament, and this part is called spinalis capitis. When acting bilaterally, all three of these muscles work to produce extension of the vertebral column and extension of the head. When acting unilaterally, these muscles work to produce lateral flexion. Deep to the erector spinae muscles, we find the transversospinalis muscle group. These particular muscles span between the transverse processes and run up towards the spinous processes, all the way from the pelvis up towards the skull cap. I'll discuss these muscles in a separate tutorial.